this point, I would like to yield 5 minutes to the gentlelady from Tennessee, Vice Chair of the full committee, Marsha Blackburn.
The gentlelady from Tennessee is recognized for 5 minutes.
Thank you, Mr. Chairman. I am pleased today to stand in support of the rule that will allow us to bring the Keep Your Health Plan Act to the floor. It is important that we take this action today on H.R. 3350 because we have heard from the American people from coast to coast, that they do not want the President's health care law. They do not like the President's health care law. They feel as if and have realized that what is happening with this law is that, number one, it is restricting their choice and options when it comes to health insurance. And number two, the cost is skyrocketing. Now, we know that that is very important to our families who have chosen health plans that meet their needs, health savings accounts that allow them to take individual responsibility for their health care, allow them the opportunities for choosing doctors and physicians and keeping those doctors and physicians. And what the American people are telling us and our constituents are telling us is that they do indeed feel betrayed by the empty promises that the President and this administration have made. They're also quite concerned about the botched website rollout, as I said, the insurance premiums, and those cancellation notices that are hitting the mailboxes of millions of Americans. And they say, you know, this is not what we bargained for. It's not what we were promised. It's not what we voted or spoke in favor of. And so they're asking us to take an action, and H.R. 3350 does take that action. Now, Mr. Chairman, I want to go back to 2010 when we had a conference and the President was before us, and I asked him a question about the ability to keep plans and individuals to stay insured. I spoke because of the experience we had had in my state of Tennessee with the test case for Hillary Care, which was called TennCare. We saw the effects of that. We knew it was the test case for public option health care. We knew it was too expensive to afford, and overall we knew it did not work. In his response, the President mentioned a little bit about some stray cats and dogs, and that he thought they had that cleaned up. But I have to tell you, our constituents and their policies are not stray cats and dogs, and they deserve to have the opportunity to keep their health care and not to be treated in a disrespectful manner or to be discarded to the sidelines. So the President needs to realize he cannot go around waving a magic wand and fixing this by executive fiat. This is a law. We are a nation of laws, and we abide by the rule of law. Obamacare, the President's health care law, is the law of the land. In order to provide relief to the American people who have clearly spoken to say they do not want this law, it requires an action of Congress. Today's action will provide relief for some individuals, not as many as we would like, but it is one step in providing some relief. The American people have grown weary of this administration spending money that it does not have on programs the American people do not want. And the President's health care law is a great example of a program that the American people do not want. So they have come to us as the people's representative and said and reminded us that we are a government of, by, and for the people, that should be working for the people. And as one of my constituents told me Monday, we the people are going to start being the people and holding this administration and this Congress accountable. Today is one of those steps that we are taking on behalf of our constituents and the people of this great nation. I thank the gentleman from Texas for the exceptional work that he has done in working with Chairman Upton from Michigan on bringing this to the floor, and I yield back the balance of my time.